Good morning. With Thanksgiving now under our belts, today on Spotlight, the presidents of Michigan's three largest public universities. In the midst of this COVID-19 pandemic, what's their leadership plan for the University Research Corridor, one of the nation's most competitive, collaborative, and prestigious higher educational partnerships? How are they helping their healthcare workers, public officials, teachers, students, parents, and business owners deal with this worldwide health crisis? We'll ask Dr. M. Roy Wilson of Wayne State University, Dr. Mark S. Schlissel of the University of Michigan, and Dr. Samuel L. Stanley Jr. of Michigan State University. It's Sunday, November the 29th. I'm Chuck Stokes, and this is Spotlight. And we should say for our viewing audience, we're recording a little earlier this week, obviously because of Thanksgiving. Today that we're recording is your actual birthday. When this airs on Sunday, you'll be a little older.
Well, I'm 63 years old and I'm trying to figure out where at least 20 of those years went.
That's okay. Well, good having you with us, and many, many more happy birthdays. All of you are medically trained doctors with MDs and PhDs behind your name. That's very unique for this state at a time when we're battling a very serious health crisis, that the leadership of our three largest public universities are led by medically trained people. From your perspective, is that a real asset for this great state at this particular time? I'll start with you, Dr. Wilson. You're sort of the dean of this group, I guess.
Well, yeah, I don't know about that, but I'm happy to go ahead and start. Well, let me just say, first of all, it's not just unusual or unique to our state. There's not that many people leading the universities who are medical doctors in the country. And so 4 of them are actually in the state, the 3 that's here, and also Ora Pescovitz at Oakland. So we have 4 medical doctors who are university presidents in the state, which is probably half of the medical doctors who are presidents in the whole country, to be honest with you. So in terms of your question, in terms of whether that's an asset to the state, I think so. And the reason why is that when you're trained medically, you're trained to accept uncertainty and be able to deal with uncertainty in a certain way. You're trained to be able to take incomplete information and be able to make decisions based on incomplete information, because rarely in medicine do you have everything that you need in order to make the diagnosis. There's always a certain amount of probability involved. And
Sure.
so you have to be able to interpret information that you have, and you have to be able to do it with a certain level of comfort that I think you get trained during your medical years.
Absolutely. Dr. Schlissel, your thoughts about this uniqueness for this state and this nation?
Yeah, I'd really agree with Roy, but I think it's in recognition of the fact that each of our universities has a substantial investment in biomedicine and health. So greater than half of the University of Michigan's budget is healthcare related or our medical schools. So I think the leadership is appropriate in that way. But it really does help us stay on top of the science and the medicine as it's evolving, and do our best job possible leading our communities, but also advising the state on issues at the interface between education and health.
Mm-hmm. Dr. Stanley?
Well, I think my colleagues have covered it extremely well. And I'll just point out very quickly that there's even more of a coincidence, because Roy and I were classmates in medical school, at Harvard Medical School, and basketball players together. So we go back a ways. I think that's actually been an asset to some degree. I think all of us knew each other before we took these respective positions. And I think that's actually been helpful for us in working together in terms of things like URC as well. And I think the medical background, just as Roy said, I think you get used to making decisions based on evidence when you have it. And I think we all feel comfortable, I think, in running a large and complex institution like a research university because of that, the ability to rely on data and try and make an informed decision. So I think hopefully it's an asset to the state.
I heard President-elect Biden's chief of staff say developing the vaccine is one thing, getting people to take the vaccine is something else. As you confront this, how important is it to be able to get that trust from people so that they will take this vaccine? Anyone can take that.
I'd say, first, it was quite uncertain that we would be able to make a vaccine against COVID-19. One shouldn't have taken that for granted. And I think it's the best news, since the pandemic started, that ultimately there will be a way to prevent the spread of the disease. The big challenge now is ramping up the production of vaccines really quickly and the logistics of distributing them. And inside of that, Chuck, is your question of getting people to have confidence in the vaccine, confidence in science and medicine, and be willing to take it. I think ultimately the pandemic has been so disruptive to our way of life all around the country that once the initial rounds of vaccination occur to healthcare workers and others who are particularly prone to the disease or to bad outcomes, and things go well in that large group, I think confidence in the public will grow and there'll be pretty high uptake ultimately, I think.
Certainly, and just in terms of this specific vaccine for COVID-19, there are some issues that have caused people to lose confidence. The fact of the matter is that in order to really make a difference, people have to take the vaccine, and about 70% of the population needs to be vaccinated in order to have effective herd immunity. And so that's a lot of people. And so we're going to have to do a really good job communicating to convince people to come out and take the vaccine, and particularly those who are most vulnerable in minority populations, particularly because that population is the population that perhaps of all of them have the least confidence in vaccines.
Dr. Stanley, who should go first? Because I've heard a whole bunch of people say, you go first, and if everything's okay with you, then I'll step up to the plate.
Well, first of all, before I answer that, I want to echo what my colleague said, and particularly talk about you, Chuck, and the media has played an incredibly important role in this. I think we have to communicate the science behind this accurately. We have to talk about how the vaccine works, why it's effective, because we assume all those things will take place. And that's going to be key to getting people to take it. So in terms of the issue around who should get it first, obviously we'll rely on the experts for the CDC. These are difficult decisions, and that prioritization, I think, should take place in a medical environment based on who really would benefit the most. I think there's two considerations you look at. One is who's potentially capable of transmitting at high levels, those people you may want to vaccinate early. And then, of course, the vulnerable populations as well. So, and that really is the elderly, particularly people in nursing homes and so on. So I think making decisions based on what's the potential mortality from the disease, as well as who might be more capable of transmitting, both those things I think will go into decisions. But we will really look for the public health experts to make that decision.
Very good. We're going to take a little break. When we come back, I want to really get into this report that you all have put out and the research and collaboration that the three universities have been doing together. We'll be right back. Stay with us. Doctors, you put out a brief. It's called Confronting COVID-19, and it talks to a great extent about how you've been working collaboratively, more so than competitively, even though I know that there's obviously some competition in there as well. But you have this university research corridor. Talk a little bit about what your individual universities have been doing, as well as what you've been working on jointly that people perhaps don't even know behind the scenes attacking COVID-19 from a research standpoint. Dr. Schlitzler, you want to begin?
Sure, of course. So a lot of our work involves our very large health system. So we have affiliations and agreements with 80 hospitals around the state, and we're taking care of very large numbers of COVID patients that allow us the opportunity to do clinical trials. So we're involved in trials on several of the vaccines, including the AstraZeneca vaccine that's been in the news just in the last day or two. Also with some of the therapies, these antibody-based therapies from Regeneron and from Lilly are also being tested at our university. And then we have a very large research community, of course, and many of them have shifted their focus onto issues of trying to understand the basic biology of the virus or the nature of the immune response, or develop even new drugs against a viral infection. And then finally, like several of our campuses, we're developing new ways to test for drugs. So test for infection or an immune response to infection using very small amounts of blood on one end, or even testing a sewage that comes out of our dormitories on campus to get an early warning of whether a dormitory has students in it who may be carrying the virus. So it's really sparked a lot of innovation. You joke about the competitiveness amongst the institutions. Really, the only time we're competing is when we're playing sports. The rest of the time, we all serve the same state. We have the same set of goals. We want to make the world a better place through research and education. And we're always looking for opportunities to do it together on behalf of the public we serve.
Yeah. Dr. Wilson, racial disparities has been something that has been talked about considerably in the media throughout all this COVID-19. I know that that's something near and dear to your heart.
MSU's Extension Service, UM's Poverty Solutions. We have a women's center that is focused on it. So I think all three universities have looked at health disparities and have tried to address it. One of the things that we've been very focused on is testing in vulnerable populations. And early on, I think it was clear that one of the reasons why there was such a huge disparity in both the morbidity and mortality among African Americans in the state is because they didn't have access to testing to the same degree that non-African Americans did. And so one of the things that we did was to develop mobile testing units and go out to these vulnerable populations to get them tested so that they would have the same access to the testing. I think that's made a big difference. Part of the coronavirus task force on racial disparities, which I'm a member of, that was one of the strategies that we employed in addition to the communication toward minority populations. But one of the strategies was to do widespread testing at the site where the minority populations live, as opposed to in sites that was remote from these populations.
Sure. Dr. Stanley, we talk about racial disparities and certainly something that we see in our large urban areas, but also there's been a focus from your universities on rural disparities.
One of the things we forget that early on in this outbreak, we actually had shortages of different foods. And one of the things that Michigan State University Extension was involved in was making sure that the supply chains from the farmers were actually getting into the cities and getting to the areas where there were food shortages and making sure that people were not either inconvenienced or actually endangered by this. So I think at the same time, we've also been reaching out in our educational mission as well. And our College of Education put together a video that showed K through 12 teachers how to teach remotely. It's been viewed literally by tens of thousands of teachers around the country. And again, that was a service both to our state and to the country for areas where they might have had difficulty getting this kind of training to provide it. So I think that rural outreach is incredibly important. But I think, again, it's the same type of service that all URC universities are doing. We just have one particular edge there in terms of our extension capabilities, but it's the same principles for all three of us.
We'll be right back. Stay with us. All of you have taken different approaches on how to deal with COVID-19 on your campuses. What have you learned? What have been the pluses and what have been perhaps the minuses that you, in hindsight, would say, oops, shouldn't have done that?
The science has been evolving since the very beginning of this pandemic. And I have to say that one of the contributions that I think that research universities in general have made, but certainly the three research universities in this state, is to contribute to that understanding of the evolving science. For example, at Wayne State, one of the things that we've been studying is why is it that the virus is very rarely passed from mother to infant, or the long-term effects of the virus, when people are not symptomatic anymore, but they do have long-term effects of whether it's a cardiomyopathy or whatever. And to me, that is what's really frightening is not so much whether someone's going to die or not. I think most of us are not going to if we get the virus. But many of us could get some long-term effects of it. So I think one of the things that I've learned, and I think that I would probably, if I do it all over again, would do a better job of, is to communicate these long-term effects to the students, because they're young, they're fairly healthy, and sometimes their behavior was somewhat cavalier.
Basic problem is none of us welcomed this pandemic and none of us had any experience with it. So what we're trying to do is preserve as much of the quality and the experience of being a Michigan student as we can, while trying to keep people as healthy as we can, trying to minimize risk. So none of the options we're choosing amongst are good options. What we've done is we've enforced sort of public health guidance of wearing masks and social distancing, keeping our classes small. And through those very simple interventions, we've managed to make it most of the way through a semester. There's no evidence of transmission of disease in our classrooms. If you wear a mask and you're in small numbers, it turns out that you can really prevent transmission. Same thing in our research labs. There's no transmission in our research labs. But unfortunately, in our dormitories, there have been too many cases, and students living in town have also gotten COVID-19 too frequently. It's very difficult 24/7 to keep continuously vigilant. And we see that around us, not just among students, but the population as a whole eventually begins suffering from COVID fatigue. And they let their guard down and disease spreads. So next semester, we've decided to lower the density in our dorms, make sure everybody has a single room, put even more of our classes online. We've gotten better at teaching remotely and hopefully producing an increasingly high quality product. We're putting some of the other things you do in college online as well, some of the group activities and extracurricular activities, career counseling, psychological counseling. So we're trying to replicate as much of the experience as we can to make it through another semester and hopefully have vaccine preventing the illness when it comes to next academic year.
As a medical doctor, has Governor Whitmer, through her executive orders, and her chief medical officer, Dr. Khaldun, have they gotten this right?
I think she and the people working with her have gotten it absolutely right. I think the actions they've taken were designed to protect public health, pure and simple, not political in nature, but designed to identify what were the measures we could take as a state, as a community, to reduce the risk of transmission and disease from COVID-19. And I think that's been the approach at all three of our campuses. And I think we've arrived at very similar places. We all need to stay focused. And I think, as said, the governor has done a remarkable job in the face of opposition of maintaining the principles of safety.
We'll be right back. Stay with us. As you head into these winter months in which medical doctors are predicting this thing is going to get worse before it gets better, what is it that you're doing both individually and perhaps collectively to make sure that you can weather this economically and not pass all of this later on down the line to students and parents?
Yeah, so way back in the earlier days, way back 9 months ago, 8 months ago, recognizing the economic uncertainty that would come from our response to the pandemic, we introduced a whole bunch of conservative measures on campus. In effect, a hiring freeze, no salary increases, of course, no travel, but that's pretty easy these days not to travel, and no unnecessary expenditures in the short term. So we really saved many tens of millions of dollars temporarily from our budget. Also, the governor and the legislature helped us out by producing a flat year-over-year funding budget. And usually higher ed complains when we don't get an increase. This time we were quite grateful that the priorities were such that they held higher ed funding and K through 12 funding flat year-over-year. But there have been layoffs, there have been a number of rifts, and it'll be more difficult, I believe, in the wintertime when our campuses are operating at lower density, our dorms have lots of vacancies and lots of lost revenue. So there are big challenges ahead.
President Wilson, as a new administration gets ready to take the leadership reins in Washington, D.C., what message would you like to send them?
Get the right people around you who are knowledgeable and listen to them, listen to the scientists. If I could just bring the discussion just for a second to a broader level in terms of economics, One of the things that we've always tried to stress is how much research is an economic driver for the state.
Mm-hmm.
But I think even more now, it's really come into more sharper focus because of the type of technologies that all three of our universities are coming up with. We've developed about a dozen technologies or so that have a direct impact on the economy in some way or another. And so that just gives you another indication of the value of research university, but particularly in this time of this pandemic, I think it's really, really important.
Sure. Dr. Stanley, I know that all three of you have been working with business leaders for Michigan, the top CEOs in this state, getting their opinions on things. What is it you're hearing from them, and how have they helped you in trying to navigate where we go economically here?
Well, I think they're very interested, obviously, in our students and our graduates. And of course, we're very interested in the job opportunities for them. So that dialogue has really been critical in helping us understand what their needs are going forward and what we need to be doing to help our students get engaged with their companies, involved with them in this very different kind of atmosphere, obviously, where so many things are now being done remote. So that's been an important component. The second thing has been just the discussion about healthcare and how one deals with the pandemic. Roy, Mark, and I all serve on the Michigan Economic Recovery Council for Governor Whitmer, where we help advise the administration on issues around returning to work, returning to jobs, et cetera.
I noticed that Paul Bunyan Trophy got its way back to East Lansing, so I know that brought a little smile to Dr. Stanley's face. But given the difficulty that some of you have been having with Indiana and Rutgers, President Wilson, you think the Warriors are ready to take on those other two now?
Well, I think that the playing field is a little bit more level.
All right, just thought I'd throw that in there for a little curveball. Happy Thanksgiving to all of you. Thank you for joining us. Best of luck in all that you're doing together through the University Research Corridor, and we'll get through all of this together.
Happy Thanksgiving.
Okay,
Great
thank you.
job.
Same to all of you. Stay safe. And I'm Chuck Stokes. We'll be back next week with more newsmakers in the spotlight. We hope you have a great week.